we're going to be putting it on our YouTube page at the end of this week. And I have a PowerPoint that I'm going to put up here in a couple of minutes. But just before I do that, one of the first slides that I'm going to share with you is a page that describes that a page that has introductions for our team that's with us today. And just a couple of points of recognition. I want to recognize our Director of Special Education, Response Intervention, and Data. He's also our interim elementary principal, and that's Brian Fairbrother. Brian, if you want to say hello.
Hello.
And we've got our technology guru, Mr. Willis. He's on here as well. Joe, if you want to say hello to everybody.
Hello there.
Joe is the meeting organizer for today. And I believe that at some point, Mr. Waskowitz is going to be, I don't see him on here yet, but he's probably going to be joining us at some point. One other notable member of our panel today, the people that are online with us today, is the Madison County Director of Health, and that is Eric Feist. Eric, you're on. All right, I do see there that Mr. Feist is online with us this afternoon, and I invited him to both today's meeting and tomorrow's meeting because the majority of what the district's responsibilities are with regard to contact tracing and COVID testing is a collaborative partnership with the Madison County Health Department. So Eric's here to answer some of the questions that may come online as well. So anyway, thank you all for joining us this afternoon. I'm just going to do a quick share. Some of the nuances of Microsoft Teams that you're utilizing today. If you move your cursor in the middle of your screen, sounds like Mr. Feist is on. Hi, good afternoon, Eric.
Hi, good afternoon. I could only get in via the phone, so I'm here.
Okay, well, thanks for joining us. I just did your introduction because I saw that it looked like you were on. It shows that you're on via computer. So, but thank you for being here.
I am, but my audio and visual is via the phone. So.
Very good. Well, thank you. So going back to just how the Microsoft Teams works, if you move your cursor in the middle of the screen, you'll see a number of you should see a number of menu options show up. There's one that looks like a text message icon, and if you click on that one, you'll be able to send a message, send a note to the panel, send a note to us. If there's something that you want to have answered throughout the course of the presentation, you can do that. And we'll also give you an opportunity at the end of the presentation to ask questions. Out of respect for Mr. Feist's time, I'm going to try to limit this conversation to that was scheduled regarding contact tracing. Doesn't mean other questions can't be asked. I'll be more than happy to answer those at the end of the meeting, but I want to have everything as much as we can be contact tracing related, so for efficiency with Eric. So with that said, I'm going to try to attempt to share my PowerPoint, and we'll get started. All right, we just had the introductions. Welcome everybody. And just a little bit of note of where we are, why we're having this meeting, and the process that we've gone through so far. In the middle of July, the New York State Education Department released a lengthy guidance document to districts on things that districts needed to keep in mind as we prepared for the reopening of schools. That document was utilized by the administrative and supervisory team of Morrisville-Eaton, and we were able to address all of the challenges in our document, the reopening plan for Morrisville-Eaton. And after that was nearly completed, There was a invitation to the entire school community, parents, teachers, we had a couple of different committees meet as well, but stakeholders were invited to take part in a steering committee discussion surrounding the tentative plan at that point. And we had about 50 participants take part in that steering conversation, where we were able to address some additional challenges, some modifications that were recommended. And then a few days after that, we had our plan ready to submit. And at that point, I notified the community through our school messaging system that our reopening plan was published and online and ready for viewing. The state ed department was in the process of reviewing all of the plans across the state. Ours is considered approved unless we hear from them that it's not. On August 7th, Governor Cuomo made an announcement about the opening of schools based on the plans that were submitted. Across the state, there were some questions that made their way to the attention of the governor, and as a result of those questions and those pieces that were showing up, he had directed all schools to post 3 distinct plans in addition to the comprehensive document that we already published. And those plans were contact tracing, COVID-19 testing, and virtual learning. In addition to publishing those 3 plans, Governor Cuomo also asked districts to have a virtual meeting with their teachers. The Morrisville-Eaton district had that meeting on Friday afternoon with a very high percentage of school employees in attendance. And the 3 meetings that we set up in alignment to what the governor had identified as being important, those 3 elements: contact tracing, COVID testing, and virtual learning. Those are the 3 themes of this week's panel discussions or virtual meetings. So we will be more than happy to answer any questions. I know that some people can make today and they can't make tomorrow and Wednesday, so any question is open when we get to that point. But please, let's start the conversation around contact tracing. So just to give you a little snapshot of what the timeline was like, on July 13th, the framework was released. There's all these steps that took place from July 13th until July 31st. And then what I just talked about with regard to August 7th being the governor's decision and his feedback, our plan is to reopen schools on September 8th. The Governor Cuomo's directive to us focused on these 3 elements. Today we're going to be focusing on contact tracing. We'll be hitting those other 3 over the next 2 days. The entirety of our contact tracing plan, this is the document that is published online. One of the 3 documents, and this is the entirety of it. What is the district's responsibility with regard to contact tracing? And what that means is if a student or a staff member or employee or a visitor tests positive for COVID-19, what does the district do to make sure that other people that may have come in contact with that individual either A, are negative for COVID-19, or B, have some level of awareness that they need to watch for symptoms. So I'm not going to read through the entire item, but the primary piece of this is that if somebody in our building tests positive for COVID-19, whether they were a visitor or whatever, we're going to be reaching out to the county health department and asking them for some guidance on what our next steps are. The district's responsibility is to be cooperative with the health department, help them access and identify who may have been in contact with those individuals. And those 6 bullets are it looks like I have a duplication in there, but those bullets there are the key elements of it. The district will keep accurate attendance records of students and staff members. The district is going to ensure student schedules are up to date. The district is going to keep a log of any visitors, which includes the date, time, and where in the school they visited. We're also going to be maintaining classroom logs of student movement throughout the course of the day, so that if somebody ends up testing positive and we know that they were in the principal's office for 45 minutes that day, who else came into contact with the principal's office for the amount of time recognized by the health department as someone that would be considered being in contact with that individual. And then the last bullet of assisting local health department in tracing all contacts of the individual at school in accordance with the protocol training and tools provided through the New York State Contact Tracing Program. And all these questions, and really it's the county health department is the one they have at least 20 contact tracers that are available to do this tracing, and they're taking the lead in that process. And the district is here to support them and provide whatever resources we can to make that tracing process as easy as possible. So as with regard to contact tracing, that's pretty much the extent of it. Mr. Feist, is there anything in particular that you want to add to it?
Yeah, thanks, Mr. Malloy. I would just make a couple of statements. More than likely, a positive test result will come to my office first before the school knows about it. So the health department receives all test results for all residents in Madison County. So we know who's been tested, whether they're positive or negative. So more than likely, how it will unfold is that we'll get a notice of a positive. We'll contact that individual and they'll say, we go to so and such a school, either as a student or a staff. And then based on our investigation, we'll follow up and contact the school to assist us in identifying where the exposures in the school may have occurred. We also, as Mr. Malloy said, we have 20 contact tracers. That's just in-house on my own staff. I also have an additional 8 contact tracers that are volunteer medical reserve corps. These are retired doctors and nurses. And we also have access to the state's ComCare system, which avails me another several thousand individuals that can assist our county in doing contact tracing. So we're quite well staffed and established to do contact tracing. And just a sidebar to that, contact tracing is part of our normal job that we've been doing for years. So this isn't new to us. We do contact tracing on any disease outbreak or activity. So it's something we're very comfortable and confident in doing.
Mr. Feist, thank you very much. I'd like to take an opportunity to give those that are in attendance today an opportunity to ask questions of the district regarding contact tracing, or Mr. Feist while we've got him on the line. Seeing as there are no questions showing up in the meeting chat, and I'm not hearing any, I'm going to go back to sharing my screen just to go through what's next, and I'll continue taking questions throughout the course and while we're online. But in the meantime, I'd like to thank Eric for joining us this afternoon and being here. He will be here again tomorrow for the brief discussion surrounding COVID testing. Eric, thank you very much for being with us this afternoon.
Sure. Thank you for allowing me to be part of this, and I'll just offer it out to anyone. If you have any questions, you can contact me directly at the health department, and I'd be happy to answer any questions that you have. We also have on our public health website a public health email kind of thing, so if you want to email it that way, you can do it that way. But feel free to contact me if you have any questions. And again, thank you.
We did get one question did come in, and it identifies, will you be keeping track of who students eat lunch with for tracing? So that's a question for the district. The answer is we will be keeping track of who students are eating lunch with, though all students will be eating in socially distanced environments, but we will have a record of who is in each lunch group. So yes, the answer to that is yes. All right. Again, Eric, thanks a lot, and we will see you. I guess we'll hear from you again tomorrow afternoon.
Good. I'll talk to you then. Thank you.
I'm going to go back to sharing, and I'll come back and take a look at the meeting chat. If somebody wants to, if somebody has a question, feel free to put your hand up as well, and we can call on you that way. There's a hand icon in the middle of your screen if you move your cursor in there. I have a question. If students are found to be positive, how will the school respond to anyone in the contact tracing process? Bus riders, hallways, classroom teachers, siblings, etc. And again, the contact tracing is fully completed by the county. It would be the county that is in contact with anybody who comes in contact with anybody who tests positive. The district's responsibility is simply to be cooperative with the county and provide them access to the records and documents. There's a level of privacy that takes place. Sometimes, well, a lot of times we won't know who it is that tests positive. As a school, we will know, but those records would be protected by HIPAA and student privacy records. However, the health department would have access to class rosters, the logs of who was in and out of a particular place, but the response and the contact would be from the health department. Same thing is true if the health department identifies that there's a number of contacts that have been identified. It's likely that there's going to be a recommendation from the health department that we close the school while certain contact tracing cases take place. So in that type of environment, we wouldn't be closing school, but we would be closing the building, and school would go into a virtual remote type setting. But we would have access to the records of who's on each bus, who's in each classroom, who traveled the halls during certain times, and so on. So again, it's primarily done with the health department is running the point on those cases. So I'm going to go back to this PowerPoint and just go through these last couple of elements, which questions we just hit, but where do we go from here? Tomorrow we're going to be, these plans can be found on our website. Tomorrow's meeting is going to be focused on the COVID-19 testing plan. And if you read the document, you'll be able to see that it's pretty limited, but Eric will be available to answer questions about testing. And then on Wednesday, we are going to be presenting the district COVID-19 remote learning plan. And that document is also posted online with what the virtual environment looks like. And we have some greater detail in the comprehensive document that was published on July 31st. So that's what we've got in store for the next couple of days. I realize that there's some people that are here on this call today that aren't able to make it, and if there are no more questions on contact tracing, I'll be more than happy to work through any other questions that you might have that are outside of the scope of contact tracing. I'll wait a minute or two to see if any questions show up in the chat. Identifying that I'm not seeing any questions. I appreciate everybody's time with us this afternoon. If you do have any questions that come up over the coming weeks, please don't hesitate to reach out to either the district office or the building principals. We would be more than happy to help get answers to the questions that are pressing. All right, thank you, everybody, and I look forward to seeing many of you tomorrow. I'll stay on until everybody's satisfied with the questions that may be lingering. All right, I'm not seeing any other questions showing up. So again, I appreciate everybody's time this afternoon, and we're scheduled to be back on here tomorrow afternoon to talk about COVID-19 testing. Feel free to give us a call if other questions arise. Thank you very much. Have a great afternoon.